of vaccines, and we have only one company which produces that. The number of vaccines is actually limited. Therefore, we are using that vaccine for the doctors who are working in the red zone and for teachers. And very soon, actually, our big pharma would accede this process. Our farm, Generium and CADA will start production of this vaccine along with the AFK system, which also has some pharmaceutical enterprises. And therefore, in 2 weeks' time, the number of vaccines offered for the civil circulation would increase 10 times, from dozens of thousands to hundreds of thousands. And very soon, actually, we'll produce more than millions of items of vaccine, and therefore, within 10 to 12 months, we'll administer the vaccine injections to 70% of the population, which, according to the textbook theory, is enough so that infectious disease is manageable by vaccines. And this is the ultimate goal for everyone who is involved in this project. The researchers and the production sites and the government of our country. We all pursue this goal. So I hope that within 10 to 12 months, Russia will make this disease vaccine manageable. So this was a brief introduction so that I could outline the topic which we are discussing today. Thank you so much. Thank you so much. Yesterday, when we discussed this session, we said that you can speak in front of anyone, even the children. The children will understand you. I want to disappoint you. I'm not sure that the school-age children may understand what you have said, but I don't think that the adult participants of the Valdai Discussion Club will actually find ins and outs in your contribution. Just there are lots of people with the college degrees, with scientific degrees, so I think that they will understand what you have said. I'm passing the floor to our next speaker. Rinat Maksutov is another developer of vaccine. And before I pass the floor to Mr. Maksutov, are you competitors with Mr. Maksutov or not? Well, regarding this disease, there are no competitors. If we bring together the production capacities available on planet Earth, in the best case scenario, Europe, Russia, China, and the United States, and everyone else, in the best case scenario, we can expect the production of about 500 to 600 items of vaccine. Million items of vaccine, and this is less than 10% of what is needed. Therefore, we cannot speak about any kind of competition. At least economic-wise, we cannot use these words. Probably there might be some competitors in the geopolitical field, but we don't have any geopolitical aspirations. Thank you so much. Mr. Maksutov, so it will take 10 years in order to vaccinate everyone. Do you think we have any chances to live in total safety and security? What do you think? Well, at least in relative safety and security. Good afternoon, dear colleagues. Before we get necessary herd immunity, millions of big number of people who have recovered from that disease and those who are vaccinated, we will have to stick to the social distancing rules and wearing masks and gloves and taking other precautionary measures. Only this way we can live relatively safely. Back to the competition issue, the whole world actually pulled together to combat COVID-19, a common pandemic. According to WHO, at the moment, 198 different vaccines are being developed. 144 are at the stage of clinical tests. Vector company initiated its work on developing a vaccine against COVID-19 back in February. We are using 6 independent technological platforms: the viral vector ones, such as vesicular stomatitis and measles, RNA, and peptide vaccines. And the choice of these technical platforms depended on the experience which we accumulated in terms of the vaccines against dangerous diseases accumulated by our company: natural measles and Ebola, fever, etc. I would like to focus on the peptide vaccine, which went through all the preclinical trials, safety trials, and efficiency trials in more than 1,500 animals, including apes, and thousands of volunteers. It was registered last week. Our vaccine is around 3 peptides, very brief fragments of the surface spike protein of the new coronavirus. Actually, we've designed them using computer modeling in order to rule out negative reactions to the antibodies, immune suppression, etc. A competitive edge of that vaccine is its efficiency against the different versions or options of the virus, because it is based on the invariable segments of the new coronavirus. So Vector R&D Institute holds some research into the genetic variability of this virus in Russia. Almost online, 24/7, we are doing the genome sequencing and identify potential mutations. About 80 nucleotic replacements have been identified, which are not recorded by the WHO, but actually these variations do not affect the efficiency of the peptide vaccine. And this vaccine is totally safe and secure for healthy volunteers, for people with chronic diseases, people with allergy, elderly. And we even consider an option to use that at our further clinical tests in children starting from age 14 to 17. The composition of the vaccine will not be altered by any means. In the framework of the clinical tests, in 100 volunteers, we confirmed not only a high safety profile of the peptide vaccine, but we showed its immune response or immune genuity, genicity. And we have necessary confirmations of its efficiency within the epidemiological research which we have conducted. And certainly we took a limited sampling, which will actually require broad test in the post-registration period. We have started the industrial output of the vaccine, and we are launching several independent post-clinical tests in patients, 100 patients, 60 plus. We're also testing that in the volunteers elder than 18 years old with chronic diseases and healthy. And we also do some clinical tests in children age 14 through 17. Naturally, we are ready for the international post-registration clinical tests. It should be noted that Vector company is very active in the international field. We are cooperating with the WHO in studying the virus of the smallpox, natural smallpox, and bird flu. And we also one of the reference labs in terms of studying COVID-19. Russia is helping other countries. More than 40 countries have got our tests, PCR tests, and we actually have upgraded epidemiological tests in a number of countries, and having such efficient tool to prevent COVID-19, and we're speaking about 2 vaccines developed in Russia, these tools can be offered to the rest of the world. I'd like to note especially another important direction. This is about the development of a common vaccine against COVID-19 and seasonal flu. This is something which we're doing all together. The relevance of this research is not only of the pure academic nature, but it is of practical application. We have done a comprehensive study of co-infecting or co-contraction with a seasonal flu and COVID-19. We actually used some rodents, and the co-contraction with the seasonal flu and COVID-19 shows the mortality rate, high mortality rate in case of co-contraction of those 2 diseases. And this year, actually, the composition of the vaccine has been changed because all the strains of COVID-19, the ones which we find in Russia and in other countries, they were altered, they have changed, and we reach an broad outreach with the seasonal vaccines. More than 60% of the population would be vaccinated, and therefore the flu vaccines acquire a lot of importance. So back to the relevant vaccines. Russia has registered 2 totally different vaccines, and the third actually inactivated vaccine is to be registered very soon at the moment. It is successfully going through the 3rd stage of the clinical test. These 3 types of vaccines have different active agents. They are designed for different target groups of people, social strata, and they are actually employing different production processes. So these vaccines are complementary but not competing, even at the stage of the production. This multi-platform approach helps us to use all the production capacities of the Russian Federation to produce different biological products.
Thanks to the decision made by the leadership of the Russian Federation in spring this year, today we have an efficient tool for the prevention of COVID-19. All our actions during the pandemic were aimed at ensuring safety and health and well-being of our population, both in the Russian Federation and other countries that our country is helping and will continue to be helping as part of our international cooperation. Thank you very much. And now, Mr. Dmitriev, you are in charge of the Russian Direct Investment Fund. Can there be a more efficient direct investment than a vaccine? Not at the moment, but when we just started, this was not an obvious decision at all. Let me give you a history of our investment decision and how we see the further development of our investments into the production of the vaccine. We started active investments in January this year when the coronavirus first appeared, and as opposed to many different other funds that decided not to invest into that sphere, they decided not to do it because many didn't understand how serious the epidemic would go, and many thought that it would be over quickly, but we saw that it was there for a long time. But first, we invested into the tests, first registered tests here in Russia for coronavirus that in 30 minutes gave you the same precision as 2.5 hours tests. We sold 15 million of those test kits. 15 million tests were sold, including to foreign countries. That's how we started. We also realized that it was very, very important to invest both in the tests, drugs, and vaccine. This was the response needed. We invested into Vifavir-based drug which was called Avifavir. It saved tens of thousands of lives. It was based on Japanese Avigan, and at first many people asked how did it happen that you were able to register your drug so fast? It was one of the first antiviral drug in the world, and Japan never proved its efficiency. But 3 months ago, or 5 months later, Japan confirmed the clinical efficiency, efficacy of that drug against coronavirus, and we, as investors, won 5 months of time, and we delivered this drug to 15 different countries. We focused on Sputnik vaccine first, developed by Mr. Ginsburg and Denis Logunov, and we will keep supporting the vector center vaccine. What made the Sputnik vaccine so special? It was based on the safest platform available. Why do we say it's a safe platform? The human adenovirus is the foundation of that. More than 100,000 people got this vaccine. The American army have been using it since 1971 to all their new recruits. So the adenovirus of human beings is the foundation. And Johnson & Johnson did the same with Ebola vaccine. This is the best studied platform to deliver the coronavirus spike. That's in that way it's different from chimpanzee RNA, or that was not approved, and the long-term consequences of that was not studied. Unfortunately, this fact is hidden in the Western media. There's no research of long-standing consequences of mRNA, and there's no study of the long-term consequences on chimpanzee adenovirus. And accordingly, we saw how the Gamaleya Center was careful about safety, and how the vaccine is purified. It's much better than what we see with other manufacturers. It's a more expensive process. It takes longer, but it allows us to avoid those side effects that we could see if there is no such purification. Mr. Ginsburg mentioned some of the basic principles of the vaccine, but again, safety. We use the adenovirus of human beings, something that we've had for tens of thousands of years. We're used to this virus. The virus is used to us. I got vaccinated myself, and my parents, who are 74 years old, got vaccinated too. And there's a clinical trial of Sputnik going on in Russia now with 40,000 people. 16,000 of them have already received the vaccine. Altogether, 40,000 people will get the vaccine until November. This is the largest scale clinical trial in the world. We got some approvals for stage 2 and 3 in India, for stage 3 in the United Arab Emirates, in Venezuela and Belarus. They also run the clinical trials of the vaccine. Russia is open, and Russia is trying to show that we want many countries to keep studying the mechanisms and see the efficacy of the vaccine. As for the international cooperation, we definitely offer this vaccine to our partners. We already signed many agreements on hundreds of millions of doses of the vaccine for other countries, and we are going to be manufacturing them outside of Russia. At first, our capacity will be focused on domestic market only, and the contracts we signed in Brazil, India, China, and Korea will be manufacturing the vaccine for external markets. A couple of final points. In conclusion, we can clearly see how important it is to unite our efforts and to have this portfolio-based approach. What do I mean by vaccine portfolio? No vaccine can be produced in the necessary quantity. No vaccine or no single technology can avoid all risks that we saw in clinical trials of such companies. We believe that mRNA and chimpanzee adenovirus technologies are least studied vaccines, but they also need to be in the portfolios. But of course, peptide vaccines should be in that portfolio, and peptide and human adenovirus vaccines should be based in that portfolio, and it will help us to avoid some disasters if during the clinical trials we will get some additional side effects. Only a portfolio of vaccines will allow us to reduce the risks for the countries, and it's not just Russia that uses human adenovirus. Johnson & Johnson is working on that. Cancino does that as well, and we have two adenoviruses, adenovirus 26, adenovirus 5. Johnson & Johnson only adenovirus 26, Cancino only adenovirus 5, and purification, which is done by the Gamaleya Institute, is of much better quality, and we think it will allow the vaccine to be one of the most efficient and safest vaccines there. Thank you, colleagues. Before I give our guests a chance to ask questions, I'd like to ask you this. I may be wrong, but this is what bothers me. When I look at the world today, I think that we see a lack of consolidation. It might seem that the coronavirus is a life or death issue. It's a very painful issue for many people. Humanity is under stress. It's hard to imagine consequences for our psyche and for mental and physical health. But I'm talking about something else. A lack of consolidation is manifested not just in the fact that there's no agreement between countries, and you don't have a feeling of planet-wide cooperation. Moreover, we have this very toxic, acid-like atmosphere in all these attacks against Russia, and in the media, it's not a friendly approach at all. Of course, you have to be critical about everything. You have to check everything very carefully. But still, there's this issue of antagonistic approach, even attacks against what we're doing. Am I right or wrong? And if I'm right, then why? I will probably start. We do clearly see a very powerful attack against the Russian vaccine, which started even before it was registered. As soon as there was information about its development, there was all this false information that had been stolen, and it happened even before registration. The Gamaleya Institute is actually much better than other vaccines. What else we saw here, this vaccine battle as an example of geopolitical rivalry. It is toxic. We hoped that there would be no rivalry. I always wanted to use this analogy, how animals, when there's no water and they come to the only water source, they don't attack each other. We saw that in the Disney cartoons, but in reality, I checked that the animals actually do attack each other, even near the only source of water, and the same is happening among humans now. And I realized that as soon as we got our tests to the market, we were immediately under the attack. I understood that in the pharma industry, people don't really like the new players. As soon as you come up with something new, the existing players try to suffocate you. The same happened with our drug. We invented the drug that is saving lives. We got 500 negative prepaid articles trying to destroy that drug. And after Japan confirmed its efficacy, nobody apologized, and nobody said, we had criticized you for using a non-registered, non-checked drug, and now it's different. But in terms of Sputnik vaccine, the researchers are quite friendly, as opposed to politicians. Latin America, Middle East, Asia, and Africa are quite positive about that. But there are targeted attacks from the West that some of the countries that are trying to stop the use of adenovirus-based vaccine in the international market. They have the right to choose not just RNA vaccine or chimpanzee-based vaccines, but we understand that Russian vaccine is the safest one of all, and everyone would recognize eventually its efficacy and safety. We need to get through this period.
Готов продолжить мысль Кирилла Александровича некоторыми конкретными примерами, некоторыми конкретными.
Let me give you some specific examples. I quite agree with what was said. Let me divide it into three parts. Negative attitude from the scientific community, negative approach from the economic component and geopolitical component. And it's obvious why they're doing all that. When we prepared that Lancet publication, let me remind you, and you were right, so that I have to explain some of the terms. Let me explain Lancet, what Lancet means. In that case, I mean the most popular medical journal in the world with 61 impact factor. Nature has 41 or 42. And when we prepared that article for the Lancet, we were not sure that Lancet would accept our article, but there were 5 reviewers, all leading developers of the globe, from the US, from Western Europe, that were working on similar vaccine-based products. We got lots of questions about our article. They were very good questions, specifying some of the details, completely science-related. We answered all those questions in written form. Our answers have been accepted, and our article was published in this most prestigious medical journal. It means one thing, that the scientific community, its main goal is to understand the nature of every product and to find the best approach to get the vaccines for the benefit of the entire humanity. These are not just lofty words. It's true. The scientific community that is working on developing something new from scratch is quite united. And there may be territorial divisions or geographical divisions. It doesn't mean it cannot have a common ideology. All scientists and researchers work as one team to get to that goal that we're talking about, to make this infection vaccine controllable. As for the economic component, the free market is divided for 10 years ahead for every ampule and pill. And when a new player comes in, and Sputnik V, as with space Sputniks, by the way, Mr. Dmitriev offered this title for the vaccine, Sputnik, and the developers just agreed. And the space Sputnik was invented in 1957, just as unexpectedly as our vaccine. Nobody believed economically that this drug could impact the redistribution of dozens of billions of dollars and would redirect those financial flows. And of course, in such a situation, you cannot expect that there will be friendly reaction from the companies to this rather strong and well-grounded player in the same field. That's why all this negative attitude that we got on behalf of the manufacturers is quite obvious. And of course, we have the geopolitical component, and we remember about November election, and nobody promised in our country to save the entire humanity using that vaccine. And on top of that, this is an argument for political struggle in just one country. I'm really shocked by the situation when you seem to have serious people who are no children at all, but they behave in a rather strange way when they say, I'm not going to be vaccinated under the Republicans. I'm a Democrat. I will be waiting for the vaccine that would be developed under Democrats. That's amazing.
That's nonsense. But at the same time, I understand that the political strife usually looks at that as a very good reasonable argument. Actually, Mr. Maksutov, I'm sure that you also have quite high standing, good standing in terms of Hirsch index. Do you want to comment on that? We see a lot of criticism, and the overwhelming majority of the criticism is totally unjustified. So we are criticized, but we're moving forward to take care of the health of the people, not only in Russia, but all over the world. Thank you so much. Ivan Sefrachuk, over to you. I'm from GIMO. Thank you so much for your very interesting contributions. This is for the second day that we are having that conference, and this is the first panel where we spoke a lot about coming together or getting together, because at the previous panels we spoke about isolation, silo, disintegration, etc. But on the contrary, you said that all the stakeholders are brought together, and that's very optimistic. I have a question to two developers, very respected ones. Tell me, you said that in your science, you have a kind of a global scientific community, that you respect each other. There are different formats which are being used by the politicians, BRICS, regional associations, Eurasian Union, NATO, etc. These political constructs, they have nothing to do with your field, with your domain. And can we say that the scientific cooperation is more intense in some of these formats? But you are globalized, you exchange ideas, you exchange honest opinions, and there is no separation, no dividing lines or driving lines are there in your field. Can you comment on that? And the question to Mr. Dmitriev. Tell me, this Sputnik, probably it will actually pave the road to something else. Do you anticipate any other projects in the post-pandemic world? Will it be easier for you to enter the global markets? Will it change the positioning of Russia at the high-tech globalized markets, or it will remain an exception? It's an emergency situation where you may assume that it would be used for further projects as a model. Thank you so much. Who will be the first one? I actually turn to the viewers. Please actually sign your comments, sign your questions. Mr. Maksutov, thank you so much for the question. Regarding the scientific community, in general, everyone works for the same goal, for the common goal to save the mankind against COVID-19. We're working in different directions. If we look at the very beginning of the pandemic, January 2019, this is on January 10th that our Chinese colleagues published the first genome sequence of the COVID-19. This allowed many countries, including the Russian Federation, to promptly develop PCR tests, which end of January became a working tool and which were used not only in all the regions of the Russian Federation, but were also supplied by Russia abroad as a humanitarian aid. Vector Lab is one of the 23 reference labs, and in the framework of that independent community, on a weekly basis, we are holding video conferences and meetings, and everyone is eager to share the data acquired within a week. We exchange most optimal protocols in terms of testing and in other areas, so no one is hiding information. The whole world community shares the data so that other countries of the world could use that efficiently. Even when we speak about the first virus which emerged in the Russian Federation, we got our real isolates early in March, and the first virus was delivered to us by Australia on February 13th. So it proves that all the countries, the international scientific community is very transparent, very open. Thank you so much. Mr. Ginsburg, you want to say something? Back to your question. It falls in the field of getting new knowledge. That's a very interesting and very crucial question, regardless of whether we're speaking about COVID-19, healthcare, biology, or we're speaking about physics, chemistry, textile, or whatever, any field of activity of a man which generates new knowledge. This process actually follows a standard template. At the upper step of that hierarchy, you may find fundamental research. After you address a fundamental objective in any area of knowledge, a technology is set up, and after technology is developed, based on that, the final consumer product would be created. This is how the God has arranged for the process which we call acquiring new knowledge. Back to the upper stage of that hierarchy, the fundamental knowledge. There are no questions about that. It belongs to the whole mankind, to the humanity. As for the technologies are concerned, the technologies belong to... You can always find who owns the technology. They belong to the country, to the corporation, or to the firm. The same is true of the end product. In order to make the country secured, the country should have not just a range of the products which economically is not justified, is not realistic, and scientifically it would be totally unjustified. Because you never know what agent is going to propagate, which agent is going to get the pandemic potential, but you may always guess the list of technologies which the mankind or the country should have, in order to, in a very brief period of time, to create everything necessary, such as diagnostics, prevention, and treatment to combat that. And the modern agents allow us to do that within a week's time. This is actually what we showcase. This vaccine, in essence, was developed within 2 or 3 weeks. So the full cycle, starting from getting terms of reference to the registration, was covered within 5 months. The technological level is the backbone of the progress and safety and security of the society, and this goes without any saying. Fundamental knowledge certainly belongs to the mankind. This is what I wanted to comment on your very interesting question. Mr. Dmitriev, over to you. Yes, you're absolutely right, saying that we see that the process of interaction with many countries in terms of vaccine will help Russia to further on interact with other stakeholders in terms of technology. We built very good relations with the regulators in 40+ countries in record-breaking time, and we set up our production sites in these 40 partner countries, and we handed over the clinical tests and other knowledge, and we built trust which the regulators in other countries see when we start clinical tests in their countries. And therefore, within several months, we held more than 200 video conferences with the regulators abroad. We are supported in that respect by the Health Ministry of Russia and the Russian Embassy in these countries. We have to showcase and tell openly about the technologies available in Russia. They have to be competitive against other technologies available. But naturally, we see that we set up a very good springboard, which may help us to offer interesting Russian technologies. It may be true of mononuclear bodies and other technologies which Russia has and which may be demanded for in other countries. Oleg Barabanov, over to you. Thank you so much. My name is Oleg Barabanov. I'm from GIMO and Valdai Discussion Club. First of all, let me congratulate both developers on their success. The whole country looked forward to the results of your activity for many months, and my question would be related to the stage of the industrial output or the massive production of both vaccines. This question actually concerns the cell environment to grow the vaccine. I read some information, probably as an amateur. I failed to understand it properly. I read about some shortage of cell environment to produce vaccine in the large scale. There was information that quasi-monopoly to produce such cell culture is one or two American companies. The question is, won't we see actually some weak link in massive production chain? I'm ready to take that question. At the moment, this problem, let's call it
проблема с расходными материалами, а на жаргонном лабораторном
consumables problem or deliverables problem, and really this is a problem typical not only of Russia but of other countries as well. And we have shortage not only of the consumables or deliverables, and there's problem with the hardware related to that technology. For the reason that the mankind has never faced such a grave challenge, not only in terms of healthcare, but you understand that we have never had such an economic challenge, starting from the launch of the first vaccine. If I'm not mistaken, it happened in 1796. English doctor created the vaccine against smallpox, and it was more than 200 years ago, and it's never been the case that vaccines would be created amid the pandemic. Usually the vaccines would be designed and developed between the pandemics, but now we have to develop that promptly when the pandemic is in the full swing. And therefore we have to introduce certain amendments to the regulations, the tests, and the commissioning of that drug. And certainly the resources available in terms of production of the vaccine is very limited, and every producer tries to address that within the funds it has, and proceeding from the track record. It depends on the logistics networks, which usually are behind the production of any drug. But luckily, we can address these problems, and Russia has a privilege, has an advantage, not an advantage, but probably a privilege. I've listed 4 production sites which can exceed the process of scale-up. And there is actually a lot of producers are lining up in order to get into the registration dossier or registration file. Once you are registered in the file, actually, you will be able not only to produce but also to sell that product in the sale market. I just listed 3 or 4 production sites which have been incorporated into our registration dossier, or they are about acceding to that list in 2 or 3 months. So it means that they have mastered the technology, they have accumulated necessary vaccines, so that all our regulators, and we have a very strong system of obtaining permits by the healthcare ministry. And usually to obtain a permit, you will have to undergo several stages. So the regulators approved of these pilot batches, and very soon they will be offered to the market. But the question which we have asked is about how much this vaccine will cost, due to the fact that there is a very long logistics chain, and as I said, it involves certain deliverables or consumables, but we know that the President and the Prime Ministers and the Health Minister publicly stated that for the Russian people, the vaccine would be totally free. So another question, how much it will cost to the state. But it would be totally free for the people, for the grassroots people. And actually, certainly the state will have to pay for that. So this is my answer to this very interesting question. Thank you so much. Colleagues, do you want to comment on that, or we proceed with the next question? So let's move forward. Fyodor, over to you. Thank you so much. Fyodor Luklianov from Valdai Discussion Club. So Sputnik, that's a very interesting name because it has several meanings and connotations, but as far as we are using that word, we have to remember that Sputnik, the one which was launched into the space, was a side product of the military rivalry. Peaceful space discovery was the flip side of the acute military rivalry. And here we see a reverse process. This Sputnik potentially has a common human meaning. This is a common boon. But at the same time, yesterday, we spoke about that the race and competition in biotechnologies become one of the determining factors in the fight for domination, for the influence in the world. Hence is my question, to what extent the competition in vaccine production may contribute to the biological and technological development of Russia, which certainly will be very much crucial as a competitive edge. Anyone wants to take that question? Any of you? Mr. Maksutov? Dear colleagues. Okay, let's start with you, and you will pick it up. Take it over from Mr. Ginsburg. You're totally right. Vaccines are the epitome of the biological technologies, because all the vaccines are the mass-use drugs. Any glitches, any bugs would be identified at the surface of the biological product. Once we're speaking about the vaccines, and these bugs actually would be detected like you look at that through a magnifying glass. So seemingly it is very smooth on the surface, but on the microscope it turns out that there are ups and downs, hills and depressions, because we're using that for lots of people, and the mankind is spoiled in the way that there are many people with chronic diseases, and if the vaccine affects and exacerbates this chronic disease, very often that vaccine will not be massively produced. Therefore, this is an arch-important question as far as this drug, this vaccine, would be used for millions of people. And I do hope that as far as our scientific community, our biotechnology community, which includes viral engineers, molecular biologists, immunologists, and biotechnologists. And as far as we're very advanced, we are in the front ranks of researchers, and we can boast the teams of researchers who can be desired and loathed by an American R&D institute. For instance, my team, and this is my main achievement over the last several decades that I'm heading the institute, managed to assemble 4 generations of scientists. And the knowledge is passed over in my institute not only through hard copies or through books, but actually is transmitted when 95-year-old fellows who not necessarily have to go to the office every day would talk to 25-year-old postgraduates, and when 95-year-olds are sharing their knowledge and without necessarily just spending several years in tests and experiments, these young scientists would be immediately explained why actually this approach will take off the ground, that it will never take off the ground. I do think that it will boost these areas, these directions, which bring together biotechnologies and other technologies in Russia. Sadly, we are supporting the scientific teams, and such an approach will boost other academia. New academia would emerge, new talents would emerge, and as a result, we'll obtain new outcomes in that high-tech region.
Thank you. All right, Mr. Maksutov, we spoke on that before this session. How would you respond to Fyodor Lukyanov's question? All right, the current pandemic will give a boost to the development of biotech in general and its individual areas. I'm not only talking about development of vaccines, but in general, working on operational readiness to quickly produce express test kits and antiviral drugs and recombinant vaccines. It also has something to do with the previous question. Our reagents and consumables are also important. They need to be available to all countries so that every country could use them to develop these areas. Developing a vaccine is just part of the part of what you need. You can develop anything in the lab, but then mass producing it, scaling it up to the level that this product would be available to every resident of the Russian Federation or every people living on Earth is a much more important and complicated task. Many countries during the current pandemic, when borders would be shut down, when there will be consequences for the EU of this pandemic, when countries were left alone in the face of this situation. Everything will, all things like that will boost the development of biotech. And the current pandemic is just first of the prelude to real threats. The real threat will come 5 years from now or during the next generation, and that's what we need to be ready for. Now, as humanity is developing vaccines that will bring its fruit in the future. I really have to run, but what I wanted to say, we are really thankful to the Valdai format, and we really hope that at a certain stage this international cooperation will be more important than competition. We interact with Middle East, with Latin America, with Asia, with some European countries. We are open for cooperation, even with the US when it comes to the vaccine. I hope that this is just a stage that we have to go through, and we hope to use political experts and those who understand geopolitics to find such solutions to the issues like the pandemic together. It's really critical. Now we are going through the second wave, and it's a common challenge for all of us. I hope that in spite of any disagreements and problems that we might have, we will still go forward together. If you need to run, please go. Thank you for participating. And you can have fundamental knowledge, applied science and technology. The same is true about study of politics. Of course, it's a different type of knowledge. May not be purely scientific, but it also can have some practical meaning. The light is such that I don't see you, but you wanted to ask a question. Andrei Frolov. And you mentioned in your presentations how Russia was blamed for stealing this vaccine. Industrial espionage is a real fact, and sooner or later the Russian vaccine will be available abroad. Aren't there risks that the Russian vaccine can be pirated, can be copied by someone, and even produced to discredit the original Russian products, and they can use all means to defend their interests. Like in nuclear arms, you can always detect where the bomb was produced. Is there an indicator that would prove without doubt that a certain vaccine was made in Russia? You pressed the button first. You were the first to press the button. All right. There's a TV game like that. Okay. Humanity has been working on that before us. They came up with patent law and know how there's a whole set of protective measures to deal with IP. Mr. Dmitriev has left for an unexpected meeting, but as far as I know, the Russian Direct Investment Fund is responsible not only for promoting this product in the foreign markets, but also ensure its patent protection and all other things that you are talking about. When we get, and we already did get the patent in our country, something that happened yesterday, our institute got a medal or some kind of award for the best patent in the country. We got it from our patent agency for the best patent of this year or the previous year. Anyway, after we got our Russian patent, automatically, even though it cost some money, we moved on to the international patenting system. And as far as I know, in 158 countries of the world, the local experts are reviewing our claim to recommend to their patent agencies whether they could register those patents in the territory of their country. For an R&D institution, it's a really expensive thing. It is financed by the Direct Investment Fund. And let me assure you that this work has been going on at a very good professional level. As for identifying a specific product, yes, you're right. The modern methods of detecting the sequence of nucleic acids, and our particular vaccine is based on a certain sequence of nucleic acids. It's quite easy to detect, and judging by that sequence, you can always determine whether a certain product is the original one or it's not authentic. Of course, modern biotech methods allow people to forge or to copy something and
Вопрос почти исчерпан. Касательно самих технологий. Технологии, которые используются здесь,
protected by the patent agency. What is protected is the vaccine against a specific disease. So if we talk about technology, yes, if they get access to this vaccine in the future elsewhere using similar tech, they could produce another vaccine against some other disease, and that would be some financial benefit for them. That's a weak side of the current technology. As for patenting the final results of our developments, it's patented. If anybody copies a COVID-19 vaccine and begins producing it, it will be for the benefit of all population. And there's something else in the question. What are the quality guarantees? You did a great job developing a vaccine in the lab. I recall the Soviet times. My parents were chemists, and they worked in chemistry R&D institutions. And the problem was they did a good job in the lab, but when it turned to mass production, the result was different. Oh, you're quite right. That is possible. When you talk about producing vaccine at our vector center, the prototype is developed in the lab. Then you study it with animals, and then you go to preclinical and clinical trials, and that can only be done for the vaccine which is produced at a production section which has all necessary certificates. We have a production unit which produces live measles vaccine, and the same section was used for peptide vaccine. These are all GMP certificates, production licenses, quality management system. This vaccine has been produced not in the lab, but in the production setting, which further, using the transfer technology principle, can be turned over to other production sites. Let me also add that in the Russian Federation, there's been a very good regulatory system that controls quality of vaccine products. It's a two-stage or sometimes even three-stage process. First of all, it's quality control for every production line, and also there was a time when our government invested significant funds into creating specialized labs all over the country, from our pharmaceutical supervising agency as part of the Pharma 2020 product, which was started by Ministry of Industry and headed by that ministry. And within that project, significant funds had been allocated to create a network of such labs that are under our supervision authority. And regardless of the size of a medical product, of course, I'm exaggerating a bit. It doesn't matter whether it's one vial or a million vials. It has to go through this supervision authority and get a certificate from this government accredited lab. After such double control, the product can go into regular turnover. As for the Sputnik vaccine, we have an agreement with the Health Ministry. Those production sites that are going to be making that vaccine and some of the other factors that I did not mention, since they're all part of our registration certificate, the Gamaleya Institute, using our own quality control, will be exercising our outgoing control. And before going to the market, every batch will go through three-stage control. If all these three stages are okay, then it's green light for the batch. We got a question remotely on the following topic. Actually, one vaccine is being tested. It's given to people, and the same vaccine, it's post-registration clinical trials that will start in November. So some of them go abroad for trials and so on. Here's what our colleague is asking. Are there any protocols or plans for the situation if anything goes wrong, or you don't consider that? What kind of risks may be there? It's a general question. It's not just protocols and plans. We also have Russian legislation on that. If anything goes wrong, then the study would be automatically stopped according to the Russian legislation. And it's also, of course, written in our protocols and plans until they find out the reason of the problem. And you concur. Okay. We only have a few minutes left. You want to ask something, okay? Thank you for this opportunity, Dmitry Stefanovich. I actually have two questions, one more practical one and one theoretical one. Too bad that Mr. Dmitriev left us, but here's my question. You mentioned the necessity to come up with a package or portfolio of different vaccines. Is there work in Russia on mRNA vaccine that can be dangerous, but in terms of hedging, is there any work in that direction? And the second one, more theoretical. We mentioned the role of the scientific community. There's an opinion then in the case of the coronavirus pandemic, the role of scientific community was dubious, including the scientific journals. There were many articles published, preprint versions that were used by the media, and they were publishing mutually exclusive information, and that would complicate the situation for decision makers. Could you say anything on that? Thank you. Thank you for this question. As for the development of mRNA vaccine, this work is also going on in Russia. This is one of the tech platforms which is used at our Vector Center against COVID-19. The prototype of this vaccine has been developed. It's been checked with a number of laboratory animals, including lower primates. We stated the efficacy of this vaccine product. But later, when we were choosing the best technological solution that we chose for the clinical trial, we chose the synthetic peptide-based vaccine. And Vector is not the only organization which is developing an mRNA vaccine for COVID-19. I think you got your answer. The only thing that I can say, RNA vaccine, this whole idea combines a pool of different products based on RNA rather than DNA. And it's an interesting area. It's not just an RNA-based vaccine, but it's RNA replicating matrix. It's interesting for me not just in terms of getting a vaccine, but in terms of dealing with a number of technological problems that so far had not been resolved using the technology that they originally meant when they spoke about RNA vaccine. Its stability, its quantity, the possibility of immune system response when you get nucleic acid into cytoplasm of any cell. It's a rather unusual situation for our cells. It might get inflammation and might lead to inflammation, and even though there are technologies now that allow us to fight that. And Kirill Dmitriev has left, but he also said that it is an interesting technology and some prospects. It is true, but using it and betting on it when you are out of time, when you don't have that much time, when you need to get the product that would save people from this agent, that would be brave to use RNA approach. Practice has shown that those technologies that have been proven or tried work better. We are also out of time, but I also have a question and a suggestion to say some final words. And there are many jokes that 2020 is just the beginning. 2021 will be worse, and you need to ask Santa Claus to have mercy on us and things like that. But as people who are deeply involved in what's going on in the world, are you afraid of the new pandemics and threats that would be even worse than what we have now? Or this will all be over and we will forget about it, we'll be just remembering it as a nightmare? In any order, what do you think? All right, starting with you.
Спасибо за вопрос.
Thank you for this question.
Текущая пандемия
The current pandemic
представляет собой
is, of course, a global threat for the entire humanity, but
вариант
you can imagine
принципиально более опасного
a much more dangerous viral agent that would have much more dire consequences.
в любом случае
And
имеет большую вероятность
there's a big probability that such situation might occur, maybe not next year or the year after that, but in 5, 10, or 20 years in the foreseeable future, humanity will definitely face a new pandemic, which will be more dangerous in terms of its scale than the current COVID-19 pandemic. It is due to a number of reasons. Humanity has progressed far, and people are in contact with animals that did not happen in the past. Even if they happened, it would happen in some remote villages. And now, thanks to this mobility, it could be spread to the entire humanity. And we shouldn't forget about modern abilities of synthetic biology, which allows you to synthesize or recover chemically almost any agent, any virus, including most dangerous virus on the planet, the virus of natural smallpox. In Canada, it was done in 2016 with the smallpox of horses, when in a chemical way they synthesized a virus with the length of 230,000 pairs of nuclei, and which has shown us that it is quite possible to synthesize much more dangerous viruses. This threat is there, and we